Hi everyone, welcome to Opportunities Worldwide. There is a new scholarship to attend the OneYoungWorld Summit happening in Montreal, Canada in September 2024. So, AstraZeneca is empowering young leaders who are advocating for a healthier, more sustainable future for young people, society, and the planet. Are you a passionate young leader actively involved in advocacy that aims to build a healthier future for young people, society, and the planet? Are you ready to be part of a global network with other young people who are creating positive change for the future? If so, we want to hear from you and want to make a meaningful difference and help ensure no one is left behind. AstraZeneca is looking for young leaders from all corners of the world who are committed to advocacy in at least one of the following focus areas: improving health equity and access, advocating to improve equitable health outcomes for all by reducing the distance between people and healthcare, particularly among marginalized and historically disadvantaged groups of young people. For example, advancing gender equity in healthcare for girls and women, mitigating the impact of climate on health and healthcare, advocating for the mitigation of the harmful effects of climate change on the health and well-being of young people, health system strengthening and resilience, advocating for stronger, more equitable health systems, prioritization of youth-focused resources, and collaboration across health system stakeholders. So, examples may include but are not limited to advocacy on these aims: advancing greater access for girls and women to have greater healthcare outcomes, breaking down barriers and enabling greater access to healthcare information and services, adopting long-term health system budget planning that addresses social, economic, and environmental factors and workforce needs, executing integrated non-communicable disease strategies that prioritize prevention and early detection, utilizing new technologies to reduce hospitalizations and improve access to high-quality, innovative care, reducing socioeconomic inequalities through a health in all policies approach, advocating for climate reduction, mitigation, and measurement measures as it links to health outcomes for young people, particularly marginalized and vulnerable groups. So let's look at the background. AstraZeneca recognizes that prioritizing prevention is essential if we are to meet the increasing demand for healthcare services and improve equitable outcomes. We need a fundamental shift from sick care to health care, gearing our health systems to act earlier to prevent and enable access to health education, literacy, and health empowerment. I'll be sharing a link to this website in the description, and I'll also be sharing a link to the official application form in the description. So if you know any young people who are innovating in healthcare, creating new solutions, please share this video with them. So what is this program? AstraZeneca's Young Health Program is a global disease prevention program with a unique focus on young people aged 10 to 24, living in vulnerable environments and under-resourced settings around the world. The YHP aims to prevent the most common NCDs, such as cancer, diabetes, heart disease, and respiratory disease. A holistic and integrated program, it combines community programs, research, and advocacy, and supports the development of young leaders. The YHP is part of AstraZeneca's sustainability commitment to accelerate delivery of sustainable healthcare and use our capabilities to strengthen health systems and improve equitable access. Okay, you come and read this at your own pace, but the main focus of the YHP is disease prevention for non-communicable diseases such as cancer, diabetes, heart disease, and respiratory disease. So this fellowship, we know that the Young One Young Summit can unlock opportunities, spark ideas, and turn plans into action. We also know that young people often experience barriers that limit access to development opportunities, especially in under-resourced communities and among marginalized groups. This program is designed to empower young people to build their skills, network, knowledge, and inspire them to scale their impact and create even more positive change. Each year, the YHP selects young people who aim to improve equitable health outcomes for all by improving equitable access to healthcare, strengthening health systems, address climate health issues, and develop the next generation of health leaders and advocates. So you can try to see what the 2023 fellows are doing. Okay, let's choose randomly. So this is from Uganda. Influenced by her own personal experiences with NCDs during her first pregnancy and the lack of resources available to her, Daisy works to improve and support networks in place for young people living with NCDs. Okay, so you talk, I think to ace this application, you should talk about your experience working on reducing non-communicable diseases and any volunteer work you've done. It doesn't really have to be your own work, but even volunteer work is applicable. So another person from Uganda is Daphne Mary Namwero. She's committed to advocating for policies and regulations that promote public health. Her passions include gender politics, community development issues, NCDs, and alcohol harm and control regulation. Daphne is a project officer at Uganda Alcohol Policy Alliance. She's also currently pursuing a master's degree in gender studies. Okay. Daphne volunteers as a social worker at Kawempe Youth Development Association, where she provides invaluable social work services to vulnerable youth and their families. Okay, let's go back to the instructions. So the selected inspiring young leaders will attend the OneYoungWorld Summit in Montreal, Canada, and they'll be accessing networks and development leading to a global health movement led by and for young people. Access to networks, participation in the 2024 OneYoungWorld Summit and Ambassador Network. There will be access to development, structured learning, and development offerings to enable you to scale your impact, including both self-directed and live learning. This includes access to the OneYoungWorld Academy, an award-winning MBA program, and professional training. The fellowship is powered by and delivered in partnership with AstraZeneca's Young Health Program. The YHP is a core part of AstraZeneca's sustainability ambition to use its capabilities to make a meaningful impact where society needs it. That's in health. So the YHP is a global disease prevention program with a unique focus on young people aged 10 to 24, living in vulnerable environments and under-resourced settings around the world. The YHP aims to prevent the most common NCDs such as cancer, type 2 diabetes, heart disease, and respiratory disease by addressing the primary risk factors: tobacco use, harmful use of alcohol, physical inactivity, unhealthy diet, and exposure to air pollution. So let's look at the YHP program here. So what will fellows receive? Fellows will receive full delegate access to the OneYoungWorld Summit 2024 in Montreal, Canada from 18th to 21st September. Return air travel from your home country to Montreal. Shared hotel accommodation in Montreal. Catering, which includes dinner on 18th September, breakfast, lunch, and dinner from 19th to 21st September. Breakfast on 22nd September, per diem of up to 38 euros per day, spent traveling to Montreal, and on the pre and post summit days of 17th, 18th, and 22nd September. Reimbursement of the Canada visa application fee of approximately $110. Return transfer from airport to hotel via public transport. Access to AstraZeneca's YHP Impact Fellowship. The fellowship will provide a combination of live and self-taught learning and development opportunities throughout the year to help fellows scale their impact. This includes, but is not limited to, participation in an award-winning online mini MBA program, complete with a university accreditation, 12 months of material access, and other opportunities. Then the last thing you receive will be an invitation to join the YHP alumni group and network with other young health leaders from around the world after attending the OneYoungWorld Summit. Okay. I'll also share a link to the Young Health Program of AstraZeneca in the description. So those who are successful will also be part of this program. So what's the eligibility criteria to apply? You should be aged 18 to 30, you should be proficient in English, you should be a national of all countries, ability to fully participate in person in the OneYoungWorld Summit, 17th 22nd September 2024 in Montreal, Canada, willingness to share insights, help corporate commitments to action, foster partnerships, and serve as ambassadors when AZ's health, equity, and YHP work where appropriate. Access to the internet and a device, computer or phone that will allow you to participate in live online fellowship sessions. Selected individuals are expected to fully participate in the YHP Impact Fellowship and OneYoungWorld Summit. Any misrepresentation or inability to participate fully may jeopardize your fellowship benefits. Most delegates are between the ages of 18 and 30. The selection committee will consider applications from those who are older than 30, pending demonstration of appropriate personal impact, initiative, and willingness to engage. Okay, so let's apply. I already have an open application form, so let's look at this. We'll start by filling in your personal information. Okay, there are 7 main pages, as you can see here. The first one is about your biodata. The second page is about voluntary diversity questions. The third is about you and your work. The fourth page is a voluntary video submission. The fifth page is eligibility declaration. 6 is additional information, and the last page is for submission. So the first page is quite easy. Your name, address, very simple things here. Then if you have any social media accounts, you can also share them here. Let's go to the next page. So these are diversity questions. You'll come and select what's applicable to you. So which area of advocacy are you most actively engaged in? Select only one. Select what applies to you. What issues are you trying to address within your advocacy work? And why are you personally passionate about that area? Why is your advocacy important to achieve healthier future for young people in your community? So those are about 4 questions in one. So make sure that you answer the questions fully. The next question is, please describe how your issue areas focus on equity for marginalised, historically disadvantaged, or otherwise vulnerable groups. For example, ethnic minorities, people with disabilities. Okay. Talk about what is applicable to you. Then the next question, tell us about a specific project or initiative you are currently working on that showcases your methodology and approach to the work. How have you identified measures of success and obstacles over the past 2 years? So really, there are about 4 questions in each of these essay questions. So try to answer all the 4 or more questions that are in one question. What are 1 or 2 areas of professional development you still need in order to be more effective in your leadership work? What do you hope the program will do for your growth at this moment? Okay. Seems this is the formula, but You shouldn't just answer one question. Answer the 4 questions that are in each of these long essay questions. What concrete steps or actions are you planning to take in 2024, 2025 that the fellowship can help you advance? So you'll come and talk about your work and what actions you're planning to take and how the fellowship will help you advance those plans. So this is a voluntary video submission. You should submit a 1-minute video in English that helps us understand why advocating for change in your chosen area is important to you. Begin your video by introducing yourself and providing your full name, and be sure to highlight the community, country, or region that is the focus of your advocacy work. Include a goal or challenge you have over the next 12 months related to one of the 3 issues you selected. Explain what steps you will take to help make the future reality. So this is almost like a summary of all the questions you've been answering. But the video is not mandatory, but a wise person has to submit a video. So they're saying you should upload your video to a video hosting website of your preference and provide us with the URL. Please ensure that your URL begins with HTTPS. If not, you'll not be able to submit it. Okay, so you can use YouTube, you can use Google Drive, you can use Vimeo or any other video hosting site. Choose what applies to you, then get the link. Make sure if it's on YouTube, make sure the video is visible publicly, and you can post it down here. So tips for creating your video: make sure you film your video in a well-lit location with the primary light source in front of you to illuminate your face rather than behind you, which will cause silhouetting. Film your video in a quiet space without background noises. Speak loudly and clearly, and review your video several times before submitting it. Okay. So I'm going to share a link to this application form and also to the official call so that you can understand everything in your own words. This is the last part. So you just have to make a declaration that you understand that you've given the right information for this application. How did you hear about this scholarship? Okay, these are important things that seem simple, but can influence your selection. Do you consider yourself to be from an indigenous community? So come and select what applies to you. If you select yes, of course you have to explain why you're an indigenous person. How did you hear about this scholarship? So here, the best you can do is to select I was nominated, because it gives you an edge compared to other people who just apply on their own. So if you select that you are nominated, you look for that OneYoungWorld ambassador that you know in your circle to nominate you and put their name here. So when you're done, you just tap on register, and that's it. If you who is watching, you're not a young person who is innovating in health, you can share this video with any young people who you know who are innovating in the health sector. With that, I'll end here. Goodbye.